Hello, and welcome to the Mimosa Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to Mimosa Diagnostics. I'm your host, Douglas Queen. Today, we are bringing you a Mimosa Matters poster chat, where you can learn from our collaborators about their important research. Thank you for tuning in and joining us on today's poster chat, where we will be hearing from Dr. Matthew Regulski. Dr. Regulski is the Medical Director of the Wound Care Institute of Ocean County in New Jersey in the United States. Welcome, Matthew.
Thank you, Doug, for having me. It's my pleasure.
Let me start our conversation by asking you a few questions about your recent poster entitled Evaluating a Biomimetic Matrix for Chronic Wound Healing with Multispectral Imaging and Thermography, a case series, such that our listeners can get some insight into your experience with NIRS imaging. Tell our listeners a brief summary of your clinical practice and experience.
Well, this is my 22nd year of practice. I treat several thousand chronic wounds a year, so I confine my practice mostly to that I've been doing for the last 20 years. Diabetic reconstructive surgery, limb salvage. I'm the medical director of the Wound Institute of Ocean County here in Toms River, New Jersey, and I'm senior partner at Ocean County Foot and Ankle Surgical Associates in Toms River, New Jersey as well. So thank you for having me.
Great, thanks. Give our listeners some background into the study featured in your recent poster at the CAMPS and SAWC conferences.
Well, it was a series of patients that we did utilizing how near-infrared can help us to assess the capability of wound healing in these patients with significant comorbidities, diabetes, vascular disease, and some real nasty wounds. So by utilizing the near-infrared, gives you real-time assessment of how blood flow is. And we need oxygen. Oxygen affects every phase of the wound healing cycle. And I coined a phrase called oxygen cares: collagen synthesis, angiogenesis, resistance to infection, epithelialization, and simplicity and sustainability. And everybody knows we need blood flow, not only bringing oxygen to the wound, but also different cell types into the wound that help for collagen synthesis, angiogenesis, like we said, reepithelialization and ECM deposition, as well as to contract the wound, remodel it, and form scar. There's multiple cell types, and there's multiple different types of growth factor, cytokine, and chemokine that are necessary for wound healing. And these are perturbed, particularly in the diabetic, where they're very compromised, they're very delayed. So obviously one of the big things that we're talking about is blood flow, and near-infrared gives us that real-time assessment in 30 seconds. Do they have adequate flow into the wound? But we know that all chronic wounds have a severe or significant hypoxic gradient to it. That's one of the reasons why, obviously, because oxygen cares, that they don't heal, but it gives you the confidence in your arterial assessment that you need to document that they have adequate flow. And if they don't, then you need to send them out to your vascular specialist. So the near-infrared gives us that safety. It gives us that feeling of completeness in our assessment of the arterial capability of these patients that are quite compromised.
Great. And what is a biomimetic matrix, and how is it used in the management of chronic wounds?
This was a synthetic, self-assembling biomimetic matrix. Really fascinating. It's a group of peptides. It's just in a gel, and you lay it into the wound, and it kind of becomes almost like tissue, like a scaffold. There are multiple proteins. They're almost in a circle, so to speak, so they're kind of resistant to the inflammation that's going on within the wound bed. They have a cationic charge, so they do have some antibacterial capability, but they stimulate an elaboration of arginine into the wound so that we can get significant nitric oxide production from vasodilation, but also then they are a scaffold, and they draw other cell types, particularly fibroblasts, endothelial cells, and keratinocytes into the wound, so that we can proceed and move the wound out of inflammation into the proliferative phase and hopefully into healing.
Tell us a little bit about the cases within your featured poster.
Well, these were very difficult patients, different cell types, mostly diabetics, some venous ulcers. And again, showing, as I start with my prepare to repair paradigm, 15 things that you do each and every time you see a wound patient. So you cover very good standard of care. You're preparing the tissue to repair itself. We just don't put the the biomimetic matrix on everybody and say there's nothing else to do. You don't have to do anything. Just put this on and everybody heals. That would be quite fraudulent of me to say that. We're preparing that tissue, removing biofilm, managing the exudate, the edema, mitigating inflammation, nutrition, the vascular assessment, in which the near-infrared does such a tremendous job for us to do. And then also talking about offloading in a diabetic foot ulcer, compression therapy for venous leg or lymphedema, or people with pathologic edema for leg ulcerations. And there's other things in that paradigm. But then by doing that, we prepare this tissue to repair itself, applying the self-assembling synthetic biomimetic matrix into that wound and allowing it to exert multiple influences of all phases of wound healing, being able to downregulate the inflammation and mitigate that and act as a scaffold to increase different cell types into the wound, and then also the elaboration of various growth factor, cytokine, and chemokine. Again, as you know, wound healing is very contextual, very complex, but this self-assembling synthetic biomimetic matrix is able to trigger all of those functions within the wound healing cascade.
And did NIRS in any way help you identify patients that should have a positive response to this?
Well, definitely. It shows you in real time what is going on in the wound bed and what is going on in the periphery of the tissue. So it gives you a full 360-degree view, of the three dimensions that is going on within the leg or within the foot, wherever the wound is. It shows you the periphery, the circulation that's there, oxygen, and also the temperature. And again, it shows you that the great thing about the temperature features, you can see if there's an acute infection going on there because you can get almost white hot in there, indicative of acute infection. But you'll see, it was interesting to see a lot of these patients were very cold on the temperature. And I think that has to do a lot with diabetics because they have arteriovenous shunting. Most of these patients were anticoagulated as well. But some of them, their temperatures were in the 70s. And you'd say to yourself, my God, how can they be that cold? It's almost like gangrenous tissue cold, which I thought was interesting. But the safety that it brings you, the peace of mind that it brings you, showing what the oxygen saturation levels are. And if they're not good, then you get them right over to your vascular specialist and more detailed testing, ABI, PVRs, toe pressures, and whatever else that the vascular person will do to delineate that blood flow and then to fix those problems, because we need blood flow. We need oxygen, we need cells, all of that into the wound to heal that wound.
Excellent. Thank you. Thank you, Matthew.
Thank you.
Thank you for giving our listeners an in-depth insight into NIRS imaging, Mimosa Pro, and its utility in clinical practice. Well, that's our poster chat for today. We hope you gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit Mimosa Diagnostics at www.mimosadiagnostics.com and check out our Mimosa Learning Plus section for a copy of the poster and the video podcast. Also visit our social media channels. Add your comments and learnings. We want to hear from you.